This is Right to Life Radio with John Girardi on Power Talk 96.7 and AM 1400, a production of Right to Life of Central California. And now, here's your host, John Girardi.
Thank you, Jonathan Keller. This is John Girardi with Right to Life Radio, a production of Right to Life of Central California, as he just said. Thank you so much for tuning in, www.rtlcc.org. We're on quarantine, baby. We are, I'm doing the show here. I'm broadcasting here from my walk-in closet. I've got my shirts all up here. What a time to be alive. What a time to be doing radio. But we're going to give you a great show, a really interesting show, an informative show about what's going on with abortion policy throughout the country, throughout the state, and particularly as it relates to the coronavirus, which is now the dominant theme, and there is a lot of news happening in that regard. All right, to dig into it today we're going to focus on a very significant man in the arena of abortion advocacy and the stuff that he's calling for right now, which relates to medication abortion. His name is Dr. Daniel Grossman, and he's a very significant figure in California pro-choice politics and national pro-choice politics. All right, so let's talk about this guy. Who is Dr. Daniel Grossman? So Dr. Daniel Grossman is, first of all, a public employee, an employee of the University of California, San Francisco, and he is on the faculty of the UC San Francisco Bixby Center for Global Reproductive Health Advances. For global reproductive health, okay? This is basically the epicenter of all that is evil and foul in abortion public policy advocacy, okay? And beyond just public policy advocacy, they also engage in research to help promote the pro-choice agenda, and tragically and horrifically and sadly, they even do training in how to do abortion at UC San Francisco. UC San Francisco, not necessarily the UCSF clinic in Fresno, which I don't think is involved in this stuff. UC San Francisco is sort of the epicenter of abortion advocacy, public policy, training, etc. within the state of California, and it is one of the epicenters of this for the entire nation. And Dr. Daniel Grossman is at the leading edge of this, okay? Many of you listening to this may remember Senate Bill 24, SB 24. This was the bill that we fought all last year, which Gavin Newsom signed into law last October or September, I believe. And this is the bill that requires all of the student health centers at all of the CSUs and UCs to provide medication abortion. Okay, medication abortion is not the morning after pill. All right, the morning after pill often has a contraceptive mechanism, sometimes contraceptive, sometimes abortifacient. This is medication abortion. Oh, that's the name of it. I kind of object to that name because it implies that abortion is medicine, or that it is medication, or that it is treating a health problem. It is not. It is just killing an unborn child. There's nothing otherwise wrong with the woman. Pregnancy is not a disease that needs medication to treat it. Dr. Daniel Grossman was one of the advocates before the state legislature at every single legislative hearing, almost every single legislative hearing that this legislation had over the course of 3 years. Okay, so the way that legislation works in the California legislature, basically a bill gets introduced in one of the two houses, either the Assembly, the lower house, or the Senate, the upper house, and it has to go through a series of committees first. Various committees have to hear the bill, hear testimony about the bill in favor and against, and they have to vote on the bill. So if you have a piece of legislation that has to do with health stuff, it gets referred to the Health Committee and maybe a couple other committees. If it has to do with higher education, the Higher Education Committee hears it. If it has to do with, if it's something that's going to spend state money, it has to go to the Appropriations Committee, okay? So it goes through all those committees, and then it goes to the floor of whatever house you're in, the Assembly or the Senate. Okay, so it goes to the committees, gets voted on the floor of the Assembly, but by all the members of the Assembly. Then it goes to the Senate, goes through all those relevant Senate committees, goes to the floor of the Senate, and the full Senate votes on it. That's how legislation works in California. For all of those legislative hearings, before it got to the floor of the Assembly or the Senate, Dr. Daniel Grossman was there, testifying on behalf of Senate Bill 24. And he was testifying to say that medication abortion should be made available on the campuses of CSU and UC student health centers. Okay? This is medication abortion. All right? Let's remember, this is an induced miscarriage. It's a series of medications, one pill that you take in the clinical setting under the supervision of some healthcare personnel, which basically cuts off the food supply for the baby, leads to the baby's death. And then you take a second pill when you get home, which is to induce a miscarriage, to expel the baby. So it's really serious stuff. It has attendant to it all of the same health side effects, all of the same possible complications that can arise out of a miscarriage. Okay, this is basically a miscarriage. All the same health risks that are attendant to miscarriage are attendant there. So whether it be, excessive bleeding, hemorrhaging, infection, there are at least 24 women who have died as a result of doing a medication abortion. Okay, this is serious stuff. This is a serious medical intervention. And the way I've heard out of Dr. Daniel Grossman's mouth that this is about as dangerous as taking Tylenol, which is a grossly irresponsible thing to say. This is a much more invasive thing that involves, even in a good scenario, will involve a lot of bleeding, will involve a lot of pain, will involve a lot of cramping, and may require a follow-up surgical abortion. In a very large percentage of cases, the woman does not completely expel everything from her uterus, not to be too graphic about it, and a follow-up surgical abortion is required to remove everything from her uterus. So medication abortions are no joke. And medication abortion, though, is very important to this new wave of abortion advocacy. I've talked a lot on the show about the old Clinton era ideology behind abortion was that abortion should be safe, legal, and rare. Safe, legal, and rare. That was the phrase used during the Clinton administration. But now that ideology it's no longer, it doesn't hold sway in the Democratic Party anymore or with abortion advocates. They don't want abortion to be rare. They don't think of abortion as something that should be rare. They don't think of abortion as something at all regrettable or something we should work to prevent or whatever. The phrasing that pro-choice activists have been using today is that abortion should be safe, legal, and universally accessible. Accessibility. That is the buzzword. That is the touchstone. Accessibility. Now, how do you make abortion universally accessible? There's a limited number of clinics throughout the country, a limited number of doctors who want to do this. And there are rural parts of the country where it's hard to get an abortion, okay? If you don't live near a big population center, the whole state of Louisiana has like one abortion clinic, okay? How are you going to make abortion universally accessible? Well, there are a number of ways in which pro-choice advocates are trying to make abortion universally accessible. One, by forcing anyone who can't afford an abortion to have it be paid for by the government. Okay, that's what we have in California with Medi-Cal. Medi-Cal pays for abortions in California. If you live in a remote place and the only hospital near you is a Catholic hospital that doesn't do abortions, pro-choice advocates think that Catholic hospital should have its conscience protections overrun and should be forced to provide abortions. The ACLU has been litigating on this very topic to try to force Catholic healthcare providers, particularly Catholic healthcare providers in remote parts of the country where there isn't another hospital nearby, isn't an abortion clinic nearby, to force them to perform abortions by alleging that by not performing abortions, they are discriminating against women. The other way to make abortion universally accessible has to do with medication abortion. Now, remember earlier in the show, I said that medication abortion, it's a 2-pill series. You take one pill in the clinical setting called mifepristone. This medication basically cuts off the baby's food supply, allows the baby to die. The second medication is called misoprostol. Patient takes it at home, expels the baby. Why do you have to take mifepristone in the clinic? Well, you have to take it in the clinic because of FDA regulations. The FDA, in the last days of the Clinton administration, and this is why, by the way, elections matter. Okay, don't let anyone tell you they don't. In the dying, waning days of the Clinton administration, the FDA rushed to approve medication abortion as being an FDA-compliant form of abortion care or reproductive care. I'm using scare quotes here because I think those terms are oxymorons, but there you have it. The FDA, a federal regulatory agency, the Food and Drug Administration, approved this in the last days of the Clinton administration because they knew once George W. Bush came into office, they wouldn't have the opportunity. When the FDA approved it, they approved it with all of these caveats. You can have medication abortion, but the first pill has to be taken in the clinical context just because we're afraid about side effects, and we want to make sure that when you take it, you're under supervision of medical personnel. What Dr. Grossman from UC San Francisco, what Dr. Grossman, who has been one of the lead public policy, healthcare policy advocates for legalized abortion, reducing restrictions on abortion, etc., what he has consistently advocated is that medication abortion should be totally deregulated. That basically you should be able just to get a prescription for medication abortion just as easily as you get a prescription for anything else. You should be able to take that medication home with you and take it at home. Or have it be shipped to your door. And in the midst of this coronavirus crisis, that is what Dr. Grossman is advocating for right now. Okay? So here's a series of tweets from him. Patients don't stop needing contraception and abortion care during a pandemic. As people are being asked to shelter in place across the nation, I explained to Rewire News why it's time that we expand access to telemedicine, including for abortion. As this joint statement from the American College of Obstetricians and Gynecologists and other reproductive medical associations explains, abortion is a time-sensitive service for which delay of several weeks, or in some cases days, may increase the risks or potentially make it completely inaccessible. The medical associations, quote, do not support COVID-19 responses that cancel or delay abortion procedures. Community-based and hospital-based clinicians should consider collaboration to ensure abortion access is not compromised during this time. I really hope that the FDA would consider, at least temporarily, lifting the risk evaluation mitigation strategy for mifepristone, that's the first of the two pills, and that states that have imposed bans on the use of telemedicine for medication abortion will also lift their bans. We need to care for patients. Okay, and of course he's characterizing abortion as care. So what is he talking about here? What is telemedicine? Basically, telemedicine involves, through an electronic means, over a HIPAA-secured server, communicating with your healthcare professional and getting prescriptions via your phone. And what does this practically mean? If you don't require someone to go into a clinic to take the abortion pill, and they can just whip out their smartphone and start chatting with a nurse practitioner on the phone through an app that looks like text messaging, and they can get a prescription right over the phone for medication abortion and have that delivered to their house as easy as an Amazon Prime package is delivered to your house, then guess what you have? Universal abortion access. No matter where you are in the country, you can get an abortion. That's what Dr. Grossman is advocating. That's what we got to fight against. We'll talk about it more after the break. You're listening to Right to Life Radio on Power Talk 96.7, AM 1400, and the iHeart Radio app. Back with you on Right to Life Radio. John Girardi here, broadcasting from my closet as I'm under coronavirus quarantine. Hope you and your loved ones are doing well as we adjust to this, hopefully not the new normal, but at least a new abnormal. So we're talking about abortion policy and this movement by this one particular researcher, Dr. Daniel Grossman, who's one of the lead researchers at the UC San Francisco Bixby Center for Reproductive Health. This is basically the epicenter of all that is bad and malign and evil within abortion advocacy is UC San Francisco. They do all kinds of horrible and malicious stuff, between advocating for horrible pro-choice policies, doing research on horrible to help promote the pro-choice agenda, and even in some cases performing abortions at UCSF. UCSF, your taxpayer-funded epicenter for all that is evil in the realm of abortion. What Dr. Grossman is advocating for right now in the midst of coronavirus is universal abortion access via telemedicine. All right, we've talked about telemedicine on the show before, so let's dig into it a little more. We touched on it a bit in the first segment, but I want to dig into this some more. So telemedicine, you may have heard of various different kinds of telemedicine services. Any of you guys out there who watch ESPN or something have probably seen ads for this service called Roman, which is a telemedicine service to help guys with erectile dysfunction, okay? So you have erectile dysfunction, you sign up with Roman, you can chat online with a doctor. Doctor can diagnose what's going on with you. It's over a HIPAA-secured server. All your information is protected. All your information is secure. And the doctor can then prescribe you some medication to help treat your erectile dysfunction. And it's all done online. You never have to see the guy face to face. You don't have to go in anyone's office. You don't have to make any embarrassing, chit chat with a cute receptionist at the office about your erectile dysfunction. It's all anonymous. And I'm not saying telemedicine is bad. Okay, I think there are a lot of ways in which telemedicine can be really creative and really good. And hey, even for erectile dysfunction, God bless. So telemedicine is becoming more and more the wave of the future. And there's a greater and greater push as we try to allow healthcare to exist across state lines, to allow more and different kinds of healthcare services to be treated via telemedicine. Now, Planned Parenthood has been on the cutting edge of telemedicine as it relates to abortion. Okay. The state of Iowa became sort of their testing grounds for their telemedicine. And as they began testing it out, in a very short period of time, about 70% of all the abortions in Iowa began to happen on people's smartphones. So let me describe what happens with telemedicine and medication abortion. You're a 19-year-old girl, you're a college student, sleep with a guy, and you figure out you think you might be pregnant, take a pregnancy test at home, you're pregnant. What are you going to do? Well, you whip out your smartphone, you Google abortion or pregnant, an ad for Planned Parenthood pops up. You get Planned Parenthood, you can download their app, the Planned Parenthood Direct app. And within seconds, you are chatting on your smartphone. And these are 20-year-olds, by the way. They're not like ready to call someone on a landline. Okay. And frankly, a lot of 20-year-olds don't want to talk to people on the phone at all. They like texting better. Okay. That's sort of the medium of communication for that generation. So they start chatting online via a text message sort of based app with a Planned Parenthood nurse practitioner. They're chatting over a secure, HIPAA-secured server. And over this chat-based app, they can exchange healthcare information, they can set up appointments for themselves, and they can even get a prescription for medication abortion right there over the phone. Now, there's one step in that process that is still a little tricky, which is that with medication abortion, based on the way that the FDA regulates it, a young woman who's trying to get a prescription for medication abortion still has to go into a clinic to get the first of the two pills that comprise a medication abortion, or a pill abortion. Medication abortion is sort of the more common name, and I don't like the name, but I'm just using it for the sake of familiarity here. The abortion pill, it's a series of two pills. Mifepristone, or RU486, is taken in the clinical context, cuts off the baby's food supply, baby dies in the womb. Misoprostol is then taken at home, and it basically induces a miscarriage, results in the woman expelling the baby. there's a ton of health risks associated with it. Basically, all of the health risks, all of the possibly traumatic stuff that is involved with miscarriage is involved in a medication abortion. Okay, so it's no joke. This is not a little thing. This is something very serious and something that can be deadly. Okay, there have been at least 24 women who have died from medical abortions, from medication abortions. A medication abortion was portrayed in the movie Unplanned. Okay, Abby Johnson herself had a medication abortion, and it was extreme. In her case, as in the case of many, many, many women who have medical abortions, it is extremely painful. It involves a huge amount of cramping, pain, blood loss. Thousands of women have been hospitalized afterwards due to hemorrhaging, loss of blood, need blood transfusions. It is no joke. So the one hiccup in the whole process is you still have to go into a clinic. Even if you're doing it via a telemedicine service, you still have to go into a clinic. And the last wall there are basically two walls that the pro-choice side wants to break down in order to make abortion truly universally accessible. One is how you pay for it. And this is why so many on the left, Bernie Sanders especially with Medicare for All, so many on the left are advocating healthcare, nationalized healthcare policies, which, regardless of what you think about the idea of universal coverage or nationalized healthcare or whatever, regardless of what you think of that, one thing that we as pro-life people and Right to Life in Central California will certainly oppose is any nationalized healthcare plan that requires universal abortion coverage, that requires abortion to be federally funded, to be universally covered in all insurance plans. That's what Medicare for All does. Okay, so this overriding pro-choice dogma that abortion should be safe, legal, and universally accessible. That's the new buzzword, not safe, legal, and rare. They don't want abortion to be rare. They want it to be safe, legal, and universally accessible. This notion of accessibility means any barrier, any hindrance to someone being able to access abortion must be knocked down. Okay? Whether that's inability to pay, the government should pay for it. Inability to access because the only healthcare provider near you is a Catholic hospital, or just a pro-life OBGYN who doesn't want to do abortions. That pro-life OBGYN's conscience rights should be overridden. That Catholic hospital's religious liberty rights should be overridden. They should be forced to provide abortion because they're actually discriminating against women by not providing them. That's the argument from the ACLU and a lot of other abortion activists. So conscience rights should be overturned. Cost should be paid for by the government, by the taxpayers. And the only other burden is just physical accessibility, being able actually to get it. Well, if you have medication abortion, which is performed simply by taking 2 pills, and you can access it right from your smartphone, the only barrier left is the fact that you have to go to a clinic. And the FDA currently still requires that. Okay, it's required that, since the Clinton administration. Dr. Daniel Grossman is advocating that no, this medication, which leads to hemorrhaging, which leads to all these bad health impacts, which has led to 24 women plus passing away. This should be more or less totally deregulated, as deregulated as the antibiotics my son is taking right now because he has an ear infection. That you just get a prescription and you can have it mailed to your door as easy as an Amazon Prime package. That is what the pro-choice side wants. They want abortion to be as accessible as Amazon Prime. Okay, and this is already sort of happening. There are already a bunch of illegal sites shipping medication abortion from India and China, where people are getting medication abortion in a way that violates FDA regulations, getting it shipped right to their door. Okay, there was actually a New York Times columnist who wrote about this whole thing. He was actually a dude who just tried to test the system and got medication abortion mailed to his house in like 3 days. So that is the future, and this is such a classic trope, never let a good crisis go to waste. To use the coronavirus pandemic as the means of saying, oh, people won't be able to go to an abortion clinic. Oh, no, we got to do something. FDA, you need to deregulate abortion right now. And this is my great fear, is the minute a pro-choice president is in office again, and it will happen someday. Okay, whether it happens in this election, the next election, the election after that, whatever. Someday we're going to have another pro-choice president. It's inevitable. And when we do, that president is going to go to the FDA and make abortion universally accessible by allowing it simply to be shipped to your house, and that you don't have to take medication abortion in the clinical context. That is what Dr. Daniel Grossman from UC San Francisco, a person whose salary is paid for by you and me, the taxpayers of California, that is what he is advocating for right now. That is what the pro-choice side is advocating. They are not about having abortion be safe, legal, and rare just for people in really exigent circumstances who just can't hack it to have a baby right now, or who are a victim of rape or incest or whatever. That's not for whom they are advocating. If any of you out there are sort of more moderate on abortion, you think, oh, I think Roe v. Wade's okay. I don't like abortion, blah, blah, blah. Understand what you're pulling the lever for when you're pulling the lever for pro-choice activists who are running for president. That's what you're voting for. Abortion to be legal for all 9 months of pregnancy and universally accessible. These are the kinds of people they are listening to, who want to override all conscience protections for doctors and hospitals that don't want to do abortion, whether for religious reasons or just ethical reasons, who want to use your taxpayer dollars to pay for abortion. This is the future. This is the future that they are trying to achieve. Okay, when we come back, we're going to talk about this issue some more. We're also going to talk, what have we got on the agenda here? We've got a lot more on the agenda as we are dealing with coronavirus. We're going to talk about Representative Dan Lipinski, the last pro-life Democrat member of Congress who has lost his seat, what that means for the future of the pro-life movement in this country. You're listening to Right to Life Radio on Power Talk 96.7 AM 1400. Back with you on Right to Life Radio. Thank you so much for tuning in. As always, this is a production of Right to Life of Central California, rtlcc.org. We're all under lockdown here at Right to Life. We've got some limited activity going on at our building next to Planned Parenthood. But other than that, all of our employees are home. All of our employees are quarantined. I'm doing this radio show from my closet, which is fantastic. So if you want to support us, learn more what's going on, we're keeping our website updated, keeping our social media accounts updated, rtlcc.org if you want to learn more about what we do. So this is an important story politically for the pro-life cause. Representative Dan Lipinski. Dan Lipinski is a very strange creature in the political landscape of America. He is the last pro-life Democrat in the House of Representatives, the last pro-life Democrat in Congress. And unfortunately, as the Illinois primary happened earlier this week, it appears that Representative Lipinski will no longer be serving in Congress. Representative Dan Lipinski conceded his primary race on Wednesday, saying that he stood by his pro-life principles even if they led to his defeat. There was one issue that loomed especially large in this campaign, the fact that I am pro-life, says Lipinski, a Catholic 8-term member of the U.S. House of Representatives, told reporters on Wednesday as primary election results showed him more than 2,400 votes behind his challenger, Marie Newman. Over the years, I've watched many other politicians succumb to pressure and change their position on this issue, he said, noting that his pro-life stance was based upon his Catholic faith and on science, which shows us that life begins at conception. I could never give up protecting the most vulnerable human beings in the world simply to win an election, Lipinski said. My faith teaches, and the Democratic Party preaches, that we should serve everyone, especially the most vulnerable, he said. To stand in solidarity with the vulnerable is to become vulnerable. There is no higher calling for anyone, but politicians don't like to be vulnerable. This is the news story about it from the Catholic news agency, CNA. So this is a really sad story. American politics used to not be this way. It used to be back in the day that really the party affiliations of people meant less than they do today. Okay, you had liberal Republicans and you had conservative Republicans. You had liberal Democrats and you had conservative Democrats. There was a real widespread. There were certain principles towards which the two parties sort of adhered. Democrats were very supportive of the New Deal, Republicans less so. But on the whole, there was a lot more crossover. And within the Democratic Party especially, there were, especially in the early days after Roe was legalized, a lot more Democrats who self-identified as pro-life. Joe Biden used to be pro-life. Dick Durbin, the senator from Illinois, used to be pro-life. Jesse Jackson used to be pro-life. Al Gore used to be pro-life. Even the Kennedys used to be pro-life. All of these stalwarts of the Democratic Party, whom today we just associate with being pro-choice, very, very many of them were pro-life, were opposed to legalized abortion, and began to change their tune after Roe v. Wade. And one of the things we have to remember, a lot of people will say things that, we don't need to change laws, we just got to change minds. We got to change minds and hearts. And I'm not downplaying the importance of changing minds and hearts, but people act as though law changes only in response to minds and hearts changing, and that law is downstream of people's opinion. And that's not always the case. It's a lot of times, in fact, very, very often, law functions as the teacher of public morals. That is a major purpose of law. That is a major function of, or side effect anyway, whether you think it's intended or not. That is what law does. Law winds up forming people in what they believe. Now, you can say, there's absolutely no crossover between what's legal and what's good. Okay, sure, that's fine. Legislators do bad things all the time. But it is still nevertheless the case that whether it's right or wrong, law has an impact in forming people's consciences. Before Roe v. Wade, most people thought of abortion as, at the very least, distasteful. After Roe v. Wade, by the time you get to 1990, something like 60 or 70% of Americans think that legalized abortion is fine, is good. They're supportive of it. They self-identify as pro-choice. An overwhelming majority of Americans, almost overnight, changed their opinion on legalized abortion after Roe v. Wade. And the Democratic Party sort of saw this as an opportunity. As they became more and more coastal, as they became more and more creatures of the Northeast, the West Coast, with a few upper Midwest states, chiefly buttressed by major cities like Chicago, Minneapolis, Milwaukee, etc., Detroit, the Democratic Party became more and more staunchly supportive of abortion. As Jimmy Carter was softly pro-choice, and I really believe Bill Clinton's support of abortion, Al Gore's flip-flopping on the issue of abortion to support it, and the Kennedys, particularly Ted Kennedy's embrace of legalized abortion, these were sort of the death knells for the notion that there would be a pro-life Democratic Party. And in the last 10 years, pro-life viewpoints have been exorcised out of, or what's the opposite of an exorcism? Where you're trying to drive angels out. Basically, pro-life viewpoints have been, kicked out of the Democratic Party to the point where now you've got Tom Perez, the chair of the DNC, who actually was outright opposing someone running for mayor of Omaha, Nebraska. I think it was Omaha or Lincoln. A guy was trying to run for mayor of Omaha, Nebraska as a pro-life Democrat, and Tom Perez was going to cut off all DNC support for his campaign. Okay, the mayor of Omaha couldn't be pro-life. You have Bernie Sanders out there saying basically abortion, to be pro-choice is a necessary prerequisite of being a Democrat. And now we've gotten to this point where the Democrats have a majority in the House and only one member of the House of Representatives on the Democratic side was pro-life. And it used to not be that way. You used to have this coalition of blue dog Democrats who would, they would support restrictions on abortion funding, or they would, be pro-life. You had Democrats in the Senate like Zell Miller. I think that was his name. Zell Miller from, I believe, South Carolina or Georgia, who were pro-life. And no longer. There is not, with Dan Lipinski losing this election, there's not a single member of the House of Representatives or the Senate on the Democratic side who self-identifies as pro-life. There's some Democrats who still support the Hyde Amendment, although the Hyde Amendment has been removed. Actually, the Democratic Party platform now says that Democrats as a party oppose the Hyde Amendment. Okay, the Hyde Amendment, which is the amendment that gets attached to the budget every single year, which cuts off all federal funding for abortion through federal health care programs, particularly Medicaid. So basically, the Democrats as a party now almost entirely support abortion. There are a few exceptions. I think the most significant exception is the current governor of Louisiana, who is actually himself a Democrat, John Bel Edwards. He is actually a pro-life Democrat, actually signed into law a really good law requiring admitting privileges for abortion providers within a certain mile radius. He's done a really good job. And he actually helped pass a Louisiana law banning abortion after, I think they passed sort of a heartbeat bill, which he signed into law. So John Bel Edwards is basically the last significant pro-life Democrat left. He's a governor of a state who is a pro-life Democrat. But other than him, there's nobody in Congress now. And that's a sad thing, okay? Right to Life Essential California, we're a 501c3. We're not a partisan organization. We don't support or oppose candidates for office. We don't support or oppose political parties. We would love to see two pro-life parties who vie with each other to see who could be the more pro-life party, okay? That's the political vision we want, okay? We wish that pro-life politics was not viewed as something partisan. We wish that, that's the accusation that's made against us, that we're just a bunch of Republican Party hacks. That's really all we care about. And anyone who listens to this show knows, we're not afraid to criticize President Trump, for example, or Republicans in Congress if they fail to do something. Okay, I've been consistently critical of the president for not adopting some of the Bush-era policies for cutting off federal funding for embryonic stem cell research. He still hasn't done it. We still have the Obama-era policies. That's like the main pro-life failing of the Trump administration. I was very critical of Congress when they were unable to cut out the abortion funding aspects of Obamacare early in the Trump administration. We're not Republican Party hacks here. But it's sad. It's really just a sad thing to see where the Democratic Party has gone, as a huge percentage of Democrats self-identify as pro-life. It's something like 25% of Democrats self-identify as pro-life. The Democratic Party, in its platform, endorses legalized abortion for all 9 months of pregnancy for any reason, publicly funded. That is so out of step with the average American and with the average Democrat and with the average person who self-identifies as pro-choice, all of which, by large majorities, would at the very least just limit abortion to the first trimester, if at all, and not have it be federally funded. So it's a very sad thing to see that Dan Lipinski, who stuck it out as a pro-life Democrat for a long time in the face of a ton of pressure and a ton of criticism and a ton of backbiting from his own party, those guys deserved a lot of credit for what they were doing. Okay, those guys deserved a lot of credit for standing tough in the face of horrible opposition from within their party. So Dan Lipinski, we salute you for staying true to your pro-life principles. And I hope he will be a voice for life as his career in Congress comes to a close. I hope he will continue to be a vocal proponent of life in whatever he decides to do after his career as a member of Congress comes to a close. We'll be back with our closing thoughts on Right to Life Radio on Power Talk 96.7 and AM 1400. We're talking about the shift in power, the shifts in pro-life politics that have happened as a result of Dan Lipinski, the last Democratic, pro-life Democrat in Congress, losing his seat. Dan Lipinski was a pro-life Democrat congressman from Illinois, and as Illinois had its primary elections earlier this week, Dan Lipinski lost his race to a pro-choice Democrat who primaried him, and he's no longer, after he's done with his term this year, he will no longer be serving in Congress. And it's sort of a historic thing to see the Democratic Party now totally bereft of any, at least in Congress anyway, of any pro-life support. And it's a shame. I really think, and I think this about the San Joaquin Valley too. This is sort of a tragedy I see with our Democratic members of Congress. You know, if there's any region in the country where a pro-life Democrat could thrive, it's right here in the San Joaquin Valley. You know, when people think about, Democratic Party politics here locally, okay, yeah, South Fresno can get pretty radical. But a lot of the Democratic Party voting and voting preferences that we see, particularly in South Fresno, for, members of the legislature and of Congress like T.J. Cox, like Joaquin Arambula, okay, like Jim Costa. Their representatives may be Democrats, but they're not huge pro-choice activists. A lot of their constituents are Latinos, Catholics, who don't necessarily support full-scale, full-on legalized abortion for any reason without exceptions, federally funded. But some version of that party line, Joaquin Arambula voted in favor of SB 24 to make medication abortion available at the student health centers of every single CSU and UC campus. All of these members of Congress, all of these state legislators, Melissa Hurtado is a state senator from that region. Similarly, this is not who the Valley is. These Democrat legislators who vote this way, I honestly wish that they could see, there are 25% of Democrats who self-identify as pro-life, and most of them live right here in the San Joaquin Valley. So, we're not a partisan organization at Right to Life. We don't support or oppose candidates or parties. I wish and pray that someday we could see a genuinely pro-life Democratic Party. That's going to do it for us on Right to Life Radio. We'll see you next week. This is John Girardi for Right to Life of Central California, signing off. rtlcc.org to learn more about us at Right to Life of Central California.